go ahead and share my screen and just pull up some quick slides to kind of guide us through the agenda this afternoon. I thank you guys so much for carrying on last month when I had a conflict and couldn't be here. And I think we launched some great work. And so for today, we really want to do some work around kind of checking in on where we are on launching our inquiry process with, kind of kicking off our needs assessment and some of the asset map work that we've been doing on the side as well. Thank you to all of you that have kind of been working offline and helping in those capacities to support that. We want to also hear from Troy, our advisor and great connection to many of the state-wide efforts that are going on around prevention planning. And we like to have a space for Troy to share with us some kind of tips from the top, if you will, and ideas that are swirling around. I know it's hard for everybody to make it to all of the great training events that are being hosted throughout these months that all the counties in California are working on this same kind of endeavor. So we welcome Troy to kind of lift up some of those highlights and engage with us around those. And then we'll spend the bulk of our time just kind of doing some updates, hearing what folks are doing to get our survey launched, give you a little bit of an update on where those numbers are right now, and what else we all need to keep the conversations and dialogues in the community going. And then hopefully, if we don't run out of time, we want to try and spend a little bit of discussion time at the end to be able to just kind of ask ourselves a few questions about Marin's capacity for prevention collaboration, because as we kind of go to think about how we want to engage the broader community in some of these ideas that may get generated from what we're hearing from the community in terms of needs, and when we start to generate some strategies for what you may want to do in Marin County going forward, I think it's good as part of the readiness to just really think about where are you in your collaborative partnerships right now across both public and private child serving systems. And I know we have a great representation here in this group, but it'll help us kind of think a little bit more broadly across what we know about the community, so that if there is any kind of precursor conversations we need to be having or outreach that needs to be having, we can start to prepare for that sort of thing. And then we'll just kind of plan next steps and priorities for our next meeting. So with that, if there's no other comments or questions about what we're going to cover today, I want to welcome Gina, joined us, I think, here. Thanks for being here. I'm going to go, yeah, hi there. I'm going to go ahead and turn it over to Troy and just have you share some highlights. Troy, I hope this was the topic that you wanted to speak to, Troy. If it's not, feel free to swap it out. But Troy had introduced us previously to this really great kind of community engagement toolkit piece that I think is just really helpful to help us think about, some of the opportunities and challenges and intentional decisions that Marin might want to make around how we're engaging the community in this process, in this planning process. So Troy, I'll go ahead and turn it over to you. And if you want to share anything different, feel free.
Can you guys hear me okay?
Yeah.
Okay, awesome. I'm going to cut my camera off because Wi-Fi is not the greatest where I'm at, and then just start our dialogue a little bit. So my first question is, and you could do a thumbs up, thumbs down if you've seen it. I think we shared the community engagement toolkit with you guys last week, correct?
Yeah.
Yes. Okay.
Yeah.
Did anybody have a chance to look at it? Because I haven't given you any real assignments or anything. It was more like leisure reading at this time. So if you haven't had an opportunity to look at it, that's certainly okay. But so here's where the challenge is going to be is I'm going to need you to look at it between now and our October meeting. Because what I've started to do is kind of delve into it. This is a huge aspect and a huge push from OCAP now. Being that all of the other things are kind of rolling with the CPP. Little sidebar, Implematics put on a training today. I don't know if any of you were able to attend, but some really, really good information that I'm hoping to be able to get with the leadership team, Leslie Ann Hay, just to pull some pieces out of that, because I think there's some really good information. So preempting my little questions that I have for the group today to think about through October. One of the things they really talked about was their theory of change and logic models, which we've already decided on, we already have, but in listening to them talk about usage, it's something I want us to begin to look at, and our asset mapping. I mean, Barry's going to be a great assistant for us. How is that going to assist any of this process? And then the integrated core practice. Again, usage. So all of those are recorded. And what I will do is make sure to share these with the group when they come out and things like that. So just keep in mind that there are all of these things coursing through right now that are going to be of great assistance to the work that we do. Templates are coming out. There are going to be some pieces around the needs assessment. So with that, back to our community engagement toolkit. What do we want our lived expertise folks to do? And I only got 15 minutes, so we're going to popcorn a few answers, hopefully, folks. But we're working through this process of bringing lived expertise to the table. And what we're encouraging is some longevity in that. We want to do some things like, how do we onboard them? We're going to have to talk about that. What are we going to do, and how are we going to support them? How are we going to identify them? Are we just going to take whoever comes? They raise their hand, they decide they're going to come, and we're going to say yes? Or do we have some sort of onboarding process? Well, what's good is we as strategies are working on an onboarding process. I'm going to be presenting that to you guys at some point. But the other questions we're going to have to answer as a group. And again, my first question is, what do we want to have them do at our table? Well, we know we want to have them bring some information, right? Information about their community. What's going on in your community that we need to know about that jives with prevention planning? That's one of the main things. But if we're going to keep them there at our meeting, and one of the things that we'll be encouraging them to do is participate either before the meeting, maybe they give us their information before or during, but what do we want them to do for us? What are some of the ideas of what we need them to do and why we're going to have them at the table? Because we're going to have to explain that to them. So if anybody has anything, just real quick, popcorn it out, but it's what I want you to be thinking about. Does anybody have any just kind of real concrete ideas of where we're at, what we're doing, what our focus is going to be?
Well, I was going to say that, you know, one of the things that we need to know about their community is what resources are they lacking? Where are the gaps, you know, in their community? That seems really kind of critical, you know, for us to be able to know.
Exactly. And a gaps analysis is going to be something we do when this survey comes back, asset mapping, because we're going to get information that goes along with our asset mapping from this survey, correct? We're going to get some information back that we can layer on top of our asset mapping, meaning when folks start telling us some stuff about what they need, we can say, wow, there are 50 agencies here that, no, we don't have 50 agencies that do anything, but wow, we have 50 agencies that are here and no one knows about them. So maybe it's an advertising problem. So that's how we're going to start to identify gaps, right? And again, I want to be a part of assisting in that process of what they do, right? Does anybody else have any ideas right off the top of their head? Because I'm just trying to generate an understanding of where we need to go, but it's kind of hard work developing that core of folks from our community. then maintaining them, and then making them feel welcome. So those are going to be 3 of our goals. And any other ideas about what we should expect from them?
So Troy, I'm glad you asked that question because I think that's the really critical piece, right? We're in this sort of task-oriented thing right now where we're going out and we're asking folks to give us input in this sort of near-term need that we have. But the bigger question is, what's Marin's ongoing engagement of those voices, right? Over time, like as partners in even overseeing the plan and, you know, making sure it hits the mark when you were rolling it out, and that sort of longer term relationship building thing you would like to do, I'm assuming.
Definitely.
With your community of people with lived experience.
Definitely. And how I see this happening is this is going to be one aspect of our project that's eventually going to fan out with a bunch of tentacles, meaning that what you do at one agency may look a little bit different than what's being done at another agency to work with your lived expertise. So once we start talking about how we're going to engage them, once we start talking about who we need to engage, how to onboard them, and how to support them, then that process will start. Larkin, you have a question?
Yeah, or just a thought. I appreciate this question, Troy. I'm thinking about, and this is like maybe classically Larkin, sort of abstract, but
no doubt.
You know, not just like what the question that's coming from me is not just what do we need from them, but also in thinking about continued engagement and feeling welcome in the space, what power are we willing to give those folks? You know, in what way will they not only share information with us, but are we hoping that they're also decision makers and, you know, in terms of implementation and direction and that sort of stuff, and how do we get clear to group around that?
Yep. That's exactly where I'm going. How much power do we wield? Are they a voting member, quote unquote, you know, things like that. Larkin, we're always on the same page, right? And what we're going to do, hopefully, as part of that process, and it's in the community engagement toolkit. So Larkin, I'll encourage you to go to, I think it might be like page 13 at some point, but there's a community engagement toolkit spectrum, moving from informing to consulting, to involving, to collaborating, to empowerment. And what we're going to need to do is 2 things. We're going to need to identify where are we on that continuum. And everybody might be different. Different agencies maybe some agencies are just informing folks. And I know that's just not the best. It doesn't create relationships. It doesn't create trust. If I just inform you and then go do the work, you don't feel involved. If I just consult with you, all I'm doing is gathering maybe what the problem is. I need to involve you, which then moves to collaboration, which then moves to me leaving at one point. I want to work myself out of a job, right? I don't want to be the community engagement specialist forever for Marin County Prevention Team, right? I want to help, but we have to get them empowered to the point where we've got somebody who is one of them that goes back to the community along with us to give us credibility. And I don't mean just one person. We're talking about a parallel process. We may bring only 2, 3 people to our particular meeting here, but we're going to have an expectation that you guys are doing it at your agency as well, right? And want to hear about that and hear about what that lived expertise looks like. Because the folks at the table, maybe at our table here, we are all the superstars, right? Not that they aren't, but we're considered the folks that go out and do all the superhero work. Well, we got to bring them in as our superheroes as well and see how they fit in this process. So definitely. So if you have not had a chance to look at it, so staying with my 15, if you haven't had a chance to look at it, please, because there's a piece that jumps out. Each agency is going to have some responsibility. And I don't mean responsibility like more work. I mean, what I'm trying to do is weave it into the work that you're already doing, right? If you have some parenting classes, let's see about recruiting there. If you have already organized folks, maybe you got somebody that's been putting their hand up for 2 years and doing a lot of things with regards to your agency. You have folks that work here. I will tell you, research tells us there's a fine line once that person leaves the community and starts to work with us. You know, do we as a group decide that that's perfect, or do we also still want somebody that's still deeply embedded in the community and may not be one of the people on our team? So things like that. So what I'm going to be doing is conversing with our leadership team, finding out how this looks. I will tell you at some juncture, I'll be asking for a few folks to do some offline work with me, and possibly with Leslie. So not going to be for the duration of this process. It'll be time limited. So feel free to put your hand up. I work for a nonprofit, so the only thing I have to give you is a Snickers bar. But outside of that, you know, I think that what we can do is put together, and again, we're doing a lot of work with my team on my side with regards to things like onboarding. So it won't be us necessarily deciding how to onboard, it'll be us how to implement the onboarding process. So know between now and October, this group will hear from me with regards to some sort of ask. And then in October, hopefully we're really setting some pieces up, because luckily for this piece, we just have to get down on paper what we're doing in our CPP plan by January, right? And we will be doing some of it, but it certainly won't be completed, like our onboarding, our helping, our developing them, our getting the output for our lived expertise for voice. It won't be completed by January, but we should have a real comprehensive idea of how we're going to do that work.
Great. No, I love that. That'll fit right in, I think, to what we've been kind of laying out here. Final thoughts or?
Yes, one other thing before I go. I don't know how many of you have gotten it. I know our leadership team has. It might still be in your inbox, but on August 23rd, which is next week, there's a comprehensive prevention planning orientation to how you get more support from OCAP, from CDFS, from all of us folks. So just keep that in mind. It's August 23rd, 1 to 4. I think, Ann, I sent you the flyer. So if you could maybe resend it to folks or put it in the chat for me. I'm a little computer compromised now because I'm actually coming to you guys from my childhood bedroom.
Okay, I was going to ask you to upload the toolkit, but that might be too much from your race car bed. Yeah.
My luggage was still on the plane, my thumb drive with that in it. I made sure to carry my computer with me because I still had some work. But yes, I'm sitting here reminiscing over old days of football and
good for
airplane
you.
models.
Well, thank you for joining us while
Thanks,
you're
guys.
trying to have family time. That's awesome, Troy. Thank you so much. Well, we will get that in. I'll grab it at the break and I can upload that into the chat, or we'll definitely send it out with the minutes. So thank you for taking a look at that toolkit afterwards. And it's page 5 of that toolkit, that continuum question. I think we'll definitely lift that up as we resend it out to folks, and you guys can take a look at that, and we can revisit that at our next meeting. And I think you know, one of the linkages that we have already kind of right now is you know, that we are you know, we're making sure that we're having that connection to the folks that we are meeting through the survey process, through the focus group process, to ask those folks, you know, would you like to continue to be involved in any way, right, with this process, so that we can at least start that dialogue of interested folks that could be candidates as you guys settle in on what some of those longer term connections to community members might look like, so that we can kind of capture that great energy that we're building right now. So thank you so much, Troy, for those reminders and connections to those resources. And again, just to remind folks of, you know, we are definitely trying to sort of build a data-informed plan here for ourselves, and we're right in the midst of that data gathering process here. So we're looking at our needs assessments, asking the community what do they need to strengthen their families, what are the barriers they're experiencing, what have they already encountered that's either been helpful or not so helpful, and to really help inform that picture. And then at the same time, going out and asking ourselves what resources and services and partnerships and connections already exist in Marin County that can maybe meet those needs that are emerging out of that inquiry, and then where are the gaps? And then again, not to do this in kind of our own echo chamber, but to bring that back out to a broader community stakeholder venue of some sort, so that when we do sort of get that story told, we can share it with a broader constituency and really get validation on that. You know, did we get it right? Did we miss a segment of the community? Do people have other ideas? Again, it's another opportunity for that ongoing involvement, which can then kind of lead to our, you know, goals and strategies and action planning around, based on really what we've learned about the community. So with that, I wanted to just, you know, again, sort of where you know, it's the old "you are here" sticker on our little timeline here. We're right in the midst here of gathering this community data with focus groups and surveys. We want this to, we do have to put an end date on it just so we can kind of keep moving, at least for this purpose. So we're trying to collect this information between last month and the end of this month as kind of our open window of intense collection of that information, so that we can then analyze the data and you know, begin to tell that story and present those findings in a way that we can get some confirmation before we sort of move forward with you know, goal setting and strategy development, and what are we going to do about all of this in Marin going forward. So so with that, I just wanted to remind everybody, for those of you that maybe weren't here last month, our survey process, we have 4 distinct sets of survey questions that are all embedded in a single link that I know you guys have been distributing, because the responses are rolling in right now, which is very exciting. And we're going to leave that window open until the end of this month. And we did manage to create a sort of integrated translated version of those 4 surveys. So if anybody would like to respond in Spanish, there's just a little toggle that they switch at the top of the first page of the survey. And then the whole thing converts to Spanish in whatever stream of questioning they're in, whether they're a parent or caregiver or a youth or an educator or a service provider. All the questions then are presented to them in Spanish, and they can respond in Spanish as well with some of the open-ended questions. So that'll all be integrated then on the back end that'll kind of support our analysis of that. And then on our focus groups, we've also created some focus group questions, particularly for parents, caregivers, and a separate set for youth is kind of our target right now. And again, trying to conduct these sorts of in-person facilitated sessions with those questions as prompts, with some support tools that we provided to everybody, a facilitator guide, and you know, the note-taking template that you can use to capture the notes, and some tips on facilitation, and those we're hoping to have hosted either by you guys as members of the CAPC, or even through connections to other community organizations that you're connected to, and we created a little cover email to share out if you do have a partner in the community that would be willing to host a conversation using our questions and bring that sort of qualitative input back to us. So the questions, if you guys haven't looked closely, they sort of parallel the survey questions, but they're a little more open-ended and you know, conversational. So they sort of support more of a dialogue, either with a group or you know, a focus group kind of setting. But the nice part about that is we'll be able to blend the findings together, right? Around the same sorts of topics of what are your needs, what are the barriers, what are the obstacles that you're facing, what's been your experience so far with strengthening families, kinds of resources in the community to meet your needs. And we do have some sessions scheduled already so far, so we'll talk a little bit about that in a moment. So I did want to, this is
Leslie Ann, real quick, I see Sandra has her hand up.
oh, thank you. Yeah, sorry, I don't have a gallery mode. Sandra, go ahead.
Just a quick question. How long does it take to fill out the survey?
You know, it only takes about 10 minutes or so.
Okay.
Maybe 15, because it's been nice because of the survey respondents so far, we can sort of tell how long they're online to complete it. So that was our guesstimate, and it seems to be playing out pretty well. So there's a lot of drop down, you know, there's a lot of just check the box of the type of thing that you're wanting to share with us. And then there's a few open-ended questions. So it's kind of a low burden sort of survey.
I have a question.
Yeah.
I've been on vacation, so we haven't really pushed this out yet to our families, and also our programs are not, some of our programs aren't happening till September. So two questions. One, is it possible to extend the deadline? And two, if we do have a focus group with first Spanish speaking parents, is it possible to get the gift cards in advance?
So your first question first, yeah, that's a good point about schools. I'm assuming you're thinking about after school gets in and some of the programs ramp up in that time frame. Yeah.
Yeah, I mean, schools are starting this week, but you know, it's a busy time for parents, and then our developmental play group doesn't start until kind of early September.
Yeah. Yeah. I mean, you know, I think what we're going to do is we're going to start to go ahead and analyze the findings, but this is just my opinion, but I want to open it up for you guys' thoughts about this. I think both from a sort of goodwill perspective with the community, and just you know, not wanting to, you know, sort of shut off great input, that even though we're giving ourselves this kind of internal deadline to start doing the analysis, I don't think it's a bad idea to keep the activities open for some period of time to catch these sorts of things that you're talking about, because that would be a shame, right? If you, and then we can just weave in that input to whatever themes we're starting to see from the, you know, from the mass that we have collected so far. But, you know, that's probably, how many are you thinking about there in terms of like programs or folks? Would that be another like couple of focus groups or something like that?
I don't know. I mean, I can only speak for us, and in terms of capacity, we could probably just host one focus group, and we probably wouldn't want to keep it. We'd probably want to keep it at like 10 or less.
Yeah.
Because I think that's a good number.
It is, definitely. So that, I think that's fine, you know, to have a few of those tentacles still trickling in, right? And particularly for that population you're talking about, that makes a lot of sense to me.
Okay.
What do others
Thanks.
think?
Yeah, I agree.
Yeah. Yeah, we don't want to cut off the conversation.
Yeah, I will, just because, you know, to wrangle a group of youth, you kind of need the after school programs
That's right.
to facilitate that with you. And I know for myself out here in West Marin, I mean, the youth are far and wide during the summer, and they're just really, they're just starting to come back to school, and the youth programs won't even be starting until, you know, September 12th, September 9th or something like that. So, you know, it would be good if I could plan on doing one in the Valley with the youth program and one in Point Reyes with the youth program.
Yeah.
So
Yeah.
it would be great.
That sounds great. And I want to, we'll talk about that in a second. Remind me of how we can kind of help coordinate ourselves around that.
Yeah.
And keep the dates straight and everything. We have that little coordination tool in Google Drive, right?
Yeah.
That you guys can plot something on there that's going to happen at a date in the future, right? And we'll know that's coming. And then we'll know what we want to, you know, try to weave into our analysis in sort of the second wave, if you will.
Okay.
Right. But the only thing I want to guard against is to be able to not sort of slow down on the momentum that is generating for some of the activities that can happen now. And we'll go ahead and do those as well. And then for these ones that make sense to do in September, that's perfectly great to fold those in as they occur. Okay.
Yeah.
And just to answer your question, Belandra, about getting the gift cards ahead of time, I think we can facilitate that if we know when it's happening and we have enough lead time and we know approximately how many participants you're hoping for. And then, of course, if there's anyone who doesn't show up, just sending any leftover gift cards back. And, we were trying to get some input about what works best for folks. I know we talked to Chloe about Visa gift cards are better for the West Marin population, but Cardenas might be a better one for your folks. Like whatever if you can tell us what you think would be better, we can customize that.
Okay. Thanks. I'll just email you.
Okay.
Thanks, Bree.
That sounds great. That sounds great. Okay, good. Thank you for those questions. And so this is even aged from here. We have more than this right now. I just did the slide and couldn't get back to it to update
Hold on,
it.
Leslie, and we might have one last question
Oh.
from Sylvia.
Yes, Sylvia, go ahead.
Hey, everybody. So regarding the gift cards, that's if we host a focus group, or if is it for people that are applying to the surveys?
This is for people who are devoting their in-person time with you.
With a focus group. Yeah.
Yeah.
Yeah. So yeah, we just don't have the resources to provide gift cards to everybody. And so, yeah, it's more the heavier lift kinds of participation.
And
Thank
then
you,
one more
Sylvia. And
question.
Chloe, you had yeah, go ahead.
Sorry.
Sylvia, you had another question? Go
Yeah,
ahead.
just under the 4 categories, what falls, so we're going to be sharing the surveys with, we have a database with all the licensed childcare providers in the county.
Uh-huh.
So send out something to them. Would they fall under like service providers or educators?
I think childcare providers, I would put under educate, their perspective, they should probably, it would be most relevant for them to provide, to answer the educator questions, because it does identify what level do you serve, and preschool is one of those.
Okay.
And it wouldn't be a tragedy if one of them answered the service provider one in that capacity. It's totally fine. You know what I mean? But it would probably just be a little bit more relevant questions for them in the educator one.
Okay. Thank you.
Thank you for that, Sylvia. And Chloe, did you have a question?
Yeah, I put this in an email and I didn't hear back from anyone, or maybe I missed something, but because I'm doing the focus groups out here at the dinner hour for obvious reasons,
Yeah.
because everybody takes an hour to get home from work. So 6 to 7 is my sweet spot. And I talked to Benita about this a few weeks ago, and she said, if we're asking people to participate in something that the county is doing during the dinner hour, we should, she said that's an approved thing for getting, essentially serving a meal. And so, I mean, it has to be reasonable and inexpensive and all of that, but I'm just wondering what kind of provisions. I know it's an added expense, but I don't feel comfortable asking families to come from 6 to 7 in the evening and not providing them with something to eat.
Mm-hmm. Mm-hmm.
So it's, I'm kind of between a rock and a hard place with this. So I don't know if I should I have already reached out to Carrie about it, and she's checking in just with fiscal to find out how we can figure that out.
I mean, Chloe, maybe you and I can have an offline conversation about it, because it's not really an item that we kind of have a budget from the prevention side, but maybe there's something we can work out H&HS wise.
Okay, that'd be great. I serve food when we do our pop-ups, but I do that out of my own pocket. So, and it's like $150 when I serve a real simple meal that I mostly make myself from scratch. So
we might be able to figure something out. Let's put our heads together.
Okay.
That's also part of what we need to be aware of, our cultural needs and how our community functions. And so I can tell you that by providing a meal, our community is always going to come together
Mhm.
around that. And so perhaps a
Mhm.
potluck would be a great way to start it and sort of build that. Culturally, I'm speaking for my community, and culturally, we build things. It's not that the government builds it for us. And so if you're looking
Yes.
for the Latino community, if you invite them into a particular activity, as long as it doesn't interfere with their earning potential to make
Right.
ends meet, they'll be there. And
Mhm.
so
Mhm.
perhaps that is part of what we need to allocate some budget to be culturally sensitive to those communities.
Mhm.
Mhm. Mhm. Yeah, I think that's a really great point, Saul.
No one would disagree with you, Saul. I think it's just a question of can we make it happen dollar wise?
Thank you.
Right. Right. Yeah. Okay, good. And again, so in terms of, we're going to talk in a second again about making those kinds of special requests if you need it, right, for one of those events. We can utilize our coordination tool to kind of document that so that we can get a gauge on that and not and sort of help ourselves make sure that we're having some consistency around that as we go out to the community around those sorts of things. Okay, so here, and I just wanted to point out here too, you guys, that, and to your point, Saul, you know, we're probably not getting it. I mean, there's less traffic, I guess we could say, on the Spanish speaking survey. Now, that doesn't mean we're not getting Latinx perspective into our responses, but that may be something else to think about in terms of making sure that the kinds of distribution and outreach that we're doing to our Spanish speaking community is such that this is a doable task, or maybe, as Saul suggested, that having it be a focus group forum is a more you know, effective kind of outreach mechanism anyway. So
Yeah, one partner that I don't see here is Canal Alliance, and I know that MCM does quite a bit of food distribution as well, and perhaps it's another way to capture some of those by a basic barcode scan, and then that link doesn't have to be typed in, which it's extremely impossible in some cases for our community members to do that. And so
yeah,
if you have a QR code
yeah,
that they
we
can
could,
just scan with their phones while they're picking up food and getting some of that information. Maybe our partner agencies like MCM and Canal Alliance could perhaps help us out get more, because at the school level, we're just getting started. Today's our first day of school. So we're looking
yeah.
at a couple of weeks to 3 weeks to really get things ironed out before we can start focusing on other areas.
So we could definitely do a little Canva poster type of thing with a QR code on it, right? And a PDF that could be made available through this group, Saul, and translate that.
Hey, Mark, how you doing?
Possibly, if I can tap Robin staff one more time for, or if anybody else has translation services to convert the language on that poster into Spanish, we could have the two versions with the QR code on each one and utilize that in multiple capacities to kind of advertise accessibility to the survey. Because then people can fill it out on their phone, right? And it's much easier. Yeah, that's a great idea.
Especially if I'm waiting in line to pick up some food, then it
Yeah,
makes it a lot easier. And if I can just scan it, I don't have to take it with me. So
that's
it could
right.
be at like a lobby, or it could be at an entrance.
Yeah, exactly. I don't know if Robin's still with us, but if there's any reason why we can't do that.
Let's talk, and I know we used a free QR code creating website that was super easy for something we did, so we could probably do the same.
And actually, yeah, we can definitely do that easily for this. Yeah, I think SurveyMonkey even lets you do that quickly and easily. Yeah. So again, one of the things we fixed on the survey, thanks to Asara, who pointed this out, we had a little toggle on it that needed to be switched over so that now, if you have an individual who would like to fill out the survey, maybe you're in a case management relationship like with them or something like that, and they're willing to answer the questions, we needed to be able to enter multiple surveys from the same device, right? So that you could sit down at the same computer and answer the survey multiple times, not for you, but for people that you're, entering the information for. So that's now available easily. It doesn't come back and tell you you've already completed the survey and you can't do it again. So so that gives us some flexibility there too. Okay. And again, we've also added this ability for people to let us know if they want to stay involved and provide us with their contact information. So that's been good there too. I'm wondering, I don't know if Isara was able to join us today.
She's not here right now.
Yeah, okay. Well, we may come back to this later, but she was just telling us about a really creative way that she's working in her agency to work with their Amigos prevention program and also with their School Works initiative for youth, where she and the other case managers there are kind of providing one-on-one support in their context as case managers for those folks or in working with those youth to help them, parents or youth, complete the survey with the case manager. And she was just referencing, and she could speak to this better if she were here, but I did want to share with you guys that, with all of you, that it really builds on that existing case management relationship that's can involve some trusted feelings in that regard, and it helps that individual feel a little bit more open, I think, sometimes to share what's been happening with their family, what their needs truly are, what some of their obstacles truly are. It also definitely bridges that digital divide. Not everybody has a device of their own that they can go off and complete this survey, nor do they have the time to participate in a focus group. So it has just lots of kind of benefits, reciprocal benefits beyond the information that we're gathering. And Asara has been trying that out. So she has some great experiences around that that I'm sure she'll share as she re-enters our group. But are others of you in that kind of a situation at all that makes sense in your agencies to have this be any kind of a tool for case managers to integrate into their work? I mean, again, only if it's not a burden, obviously, on the case manager's workload already. But if there's a particular prevention program or relationship that's established anyway, that's sort of in a prevention frame with folks, it might make good case management sense anyway to be talking about these sorts of things.
Yeah, I'd say just Seneca is sort of maybe in a parallel process with Isaura's program. We run the School Works program for the San Rafael district and are doing a similar distributing with the parents in that group. And that group is entirely, that client group is entirely Latinx, and the great majority of the parents are Spanish speaking, and we're going to be doing it sort of facilitated by the case manager. So
yeah, good, excellent. All right, well, keep that in mind, you guys, for everyone to see if that's an opportunity that we can distribute that survey. But we sort of started talking about this earlier. I just want to pause here and make sure there aren't other questions about kind of hosting a focus group that we need to cover. I can certainly show you this coordination sheet and how that's getting filled out so far, if that would be helpful. But anything around the preparation or the facilitation itself or the follow-up, I know, Chloe, you might be the closest to getting some of these activities launched, not in the near future. Do you feel like you got your questions answered? And
Yeah, I think so. I think just pending the meal question, and then Anne, I was hoping that you and I could offline figure out about the note-taking piece, because I don't think I could do the notes and facilitate the conversation. I think that would be a challenge.
Yes, absolutely. I'll email you about that. for
Okay.
sure.
That would be great. Thank you so much. And then I'm getting the dates nailed down for the other two events. I have a third one, a fourth one that's pending. Gosh, so yeah, I may be doing the most focus groups of this entire group. I don't know. I feel like West Marin focus groups are so much more effective than any other modality for addressing questions. So
oh, absolutely. Yeah, yeah. Is anybody else contemplating hosting a focus group? Oh, hi, Sarah. She's joined us now.
Hey, I'm so sorry. I was in a previous meeting that was recorded.
Oh, no worries, no worries. Your ears were maybe burning. We were talking about this great one-on-one work that you've been doing. And did you want to share any more about your experiences with that, Sarah?
Yeah. So I have been administrating this survey with our amigos families. We have this prevention program and also the School Works Initiative. And today, actually, I share the link with the rest of the case management team so that they can be able to also to help and share the link with other families, not only within the two major programs that we have here, but also with the other families that we are able to work with, and also my other co-workers in the agency. So I'm hoping that we'll get more in there.
Absolutely.
But I am conducting these surveys individually with the families, and sometimes they need more support than, some families need more support than others. And as I was sharing with Leslie yesterday, sometimes families don't, this family was not able to open the link on her phone. They just have those basic phones, and sometimes it doesn't work. So, and I was not able to use the link on my computer because I already completed the survey. But now actually I can do multiple surveys in my computer, Leslie.
Yay, it worked. I know. I
worked.
was happy to hear that you say that you actually did it. Okay, that's great. That's great. Good. And it feels like I love that we have this little window into people's reactions to being asked these questions. Like, how have people responded? Are they like, do they feel like these are relevant questions for their lives? And is it?
Yeah, yes. And actually they have, they have hope that after this survey and after sharing their own experiences, that they are, expecting some changes.
Well, that's true. Yeah.
Yeah. So I have been hearing a lot about, mental health services, scholarships for childcare has been difficult. Housing, that's a big one too. And yeah, so we're trying to complete those surveys.
Yeah, that's excellent. That's so great. And we'll put that together. But it's true. I mean, we are kind of raising expectations, and that's again why it's so important to kind of come back to the community with what we've learned, what we've concluded, where this is heading in terms of next steps and what's possible. So appreciate all your efforts for that from everyone who's doing that. I wanted to just so thank you so much for that. I wanted to just show you quickly. Let me just share my screen again and show you everybody has access to Drive, right? You have that link, right, from last time. And so we've got kind of all the the tools in here for all of our outreach activities are in that drive. And I just wanted to show you this one, the Marin Community Outreach Coordination Sheet, which is kind of our internal tracking sheet. And here you can see Chloe's 3 sessions that are on here. And this is just an example in the first row, but these ones that are not in italics here, it's, what kind of a focus group is it? Who are you having it with? What's the number of folks you expect to invite? Do you need a Spanish translation? And when is it happening? Is it virtual or in person? Who's your note taker? Or do you need one? And then this, please use for any kind of support outreach for it, anything that you need in terms of making that happen that you don't have from the tools that we've already provided, because we'll be monitoring this all the time. Obviously send an email too, but this way we can kind of keep track of, do we need to, create a few more opportunities for certain types of groups, and where are we headed with this? So for those of you that may be planning these out into the future a little bit more, feel free to put them on here and just put the comment that, to be scheduled or to be determined, but at least we'll know what groups then, like Balandra, if you want to go ahead and put your groups that you're thinking about in here, and then even if they don't end up happening or whatever, we'll at least know that they're sort of on the horizon. Does that make sense?
Yep.
So you don't have to wait till you fully scheduled it to get it on here. Okay. Okay, perfect. All right. So let me stop sharing that. Any other questions before we kind of shift gears here a little bit and move on to asset mapping? I just want to thank everybody so much. Next time we'll have some findings, right? We'll have kind of drawn a line in the sand, if you will, for however many surveys we get by the end of August. And I want to start to clean the data and do that analysis so that we can start to see what are some of those top line findings and themes that are emerging from what folks are saying. So stay tuned for that next month. So Barry, why don't I turn it over to you?
Sounds good. So the asset mapping process is moving along. Thanks to everybody who provided input. I think a number of you provided input and a number of you had people provide input on the different types of services. I can share my screen and show you the latest version of it. Can you see it?
Yeah.
Great. So just a refresher, we decided to organize it according to the social determinants of health. So the different colors across the top here represent those social determinants of health categories. And then along down here on the left-hand side of our matrix, we have all the different names of agencies and supports, and you can see it's a pretty extensive list. And then the X's indicate, you can see it's quite an array of services here. So there's, how many rows are there? There's 82 rows. And then we also can total them up. So you can see how many you have in each of these domains of the social determinants of health. So how many provide 15 agencies provide physical health services, 18 mental health, and 9 substance abuse. Got your feedback from last time, which was very helpful. I was able to, as a result of your feedback, separate out the column for education. We had childcare and early education and parenting and sort of adult, education and literacy all in one bucket. And I agree. I was kind of struggling with that as well. So I took those 3 out. So there's parenting, education, literacy, and job readiness. And then childcare and early education are now 3 separate categories that you can see the different agencies that provide that. One ask I have is there were only 5 agencies that ended up with parenting. I suspect there's probably more. And so I wondered whether one of you had someone who does a lot of referral for parenting who I could touch base with and just, kind of verify that list and make sure we have everyone listed on it.
You mean parenting education specifically?
Yes.
Yeah.
Can you show us who you had?
Sure. Let me look at the other format. Let me show you the other format. Community Action Marin, Healthy Families Marin, Matrix Parent Network, Postpartum Support Center, Seneca.
Oh, you're missing North Marin Community Services.
Okay, good.
I mean, I would say Parent Services Project does parenting education as well, although it's not right now we don't do any formal training like CAPC, for example.
Okay.
And we know that is a need.
So North Marin, if you wanna, I don't know if you wanna add more details into North Marin, but we do for specific programs, we do the CAPC.
Oh, okay.
And we also, yeah, CAPC, and we also have the twice a year, my co-worker Berta Campos Aniceri, she runs this series of parenting classes for youth.
Okay.
And the focus on those classes is for the prevention effort for the drug and alcohol use.
Oh, okay.
And as case managers, actually, we do provide a lot of an ongoing parent coaching.
Just gonna
fill
these in so that I remember to add them to the rest of it. Okay. Well, so if other folks, if there are other parenting education resources, it just seemed like there were probably more. So I wanted to ask on that one specifically.
What about the class that the county has? I know the county, Marin County has, I believe is Juanita who runs the parenting classes in Spanish, and Michelle runs the parenting classes in English through the county.
Through the Child Welfare Department.
It's actually, it's not through child welfare.
No, it's not through child welfare.
Oh, okay.
I don't know exactly. Is it through behavioral health?
Uh-huh. It's through behavioral health and community, yeah, and recovery services.
There you
Okay.
go.
So is it
It's through, you could say BHRS, Behavioral Health and Recovery Services, Marin BHRS.
Oh, okay. Yeah, that's in the matrix elsewhere. Okay.
Mm-hmm.
Okay. Well, if anybody has any more in that category, please let me know, or let Leslie know. And the other feedback that you had that I think is really important and good was that you wanted more insights into language ability and language, the sort of specifically Spanish speaking language, and area, region, and also age, and specifically that 0 to 5 age group. So what I'd like to propose for that, we could try to code all of these 72 resources that way, but I think that would be a formidable effort to do that. And this larger asset map really gives us that sort of big picture of where what assets we have. What I'd like to propose, our plan was to go to move forward from here and kind of take a deeper dive with some key providers, and you all provided some other key providers. This list here is our list of the ones that we thought we would maybe take a deeper dive and do an interview with. And the interview will ask them about their programming and really get some more in-depth information on where they provide services, what languages they provide services in, what the gaps are between the languages that they provide, or whether there's a waiting list that's happening for language for Spanish speaking or for non-Spanish speaking, what the differences are. So I'm proposing that we use that strategy, this interviewing strategy, to get that information, rather than creating multiple tabs on the asset map. So I wanted to run that by folks and see if they thought that would be the way to do that. And then we'll aggregate all the information from the interviews. So we'll have information from those key informant interviews, key agency interviews, that will give you some really much more detailed information about the service array in terms of those factors and other factors. What do folks think about that?
I think it's a great idea.
Seeing some nodding heads. Any concerns about that?
Can I just ask a clarifying question? You may get to this later, Barry, but just when you guys say indicate what region the service relates to, do you mean where they're physically located, or the catchment area that they serve, or what does that classification mean in your mind? Is that a geographic indicator of, you know what I mean? Where, like when you say we're going to organize these resources and services regionally, what does that mean to you?
And I put up on the screen this question from the interview because it was one of the areas that I had highlighted that I wanted to ask you the same question, sort of how you define those regions. You know, will it be obvious to folks where they fit?
Like this is how Barry and I interpreted that. Where do you deliver the majority of your services? If you were to ask that directly of the program, and then they would pick one of these geographic regions. Is that what you mean? Is that what you want to know when you say regionally, or are you thinking of something else?
I hope someone else will say something, but
Are you, I'm confused. Who are you asking, Leslie Ann?
I think it's,
I'm asking all of you, because
Yeah,
this is a fact that you wanted to know about your asset map contents, and we want to make sure we're asking the question.
I think it's important to know. I think it helps us to distribute, you know, the types of services, you know, as far as, you know, we're determining where is the need. And so, yeah, to me, it makes sense.
I mean, it's kind of both and in my mind, Leslie Ann and Barry, because a lot of the families that we serve, especially if there's certain geographical concerns, they may have transportation challenges. So even if the catchment area is large, it really does kind of depend on where the service is being delivered in terms of our, you know, unless the services, the staff go out to the client homes, then where it's located really is where the service is. Because I know Chloe made this observation in the past that there's a couple services that say we serve all of Marin, but the reality is they don't actually serve West Marin. So
yeah, well,
that's a good point that you're making too, Bree, because there are, like Seneca, for example, they serve, you know, a broad area, you know, and they're in-home services a lot of times too. So kind of depending on what the service is. So, and there's other service providers like that as well, behavioral health and a number. So, but it is good to know like where the service is located, as well as, what is the geographical area that they serve?
Yeah. Okay, good. So, you know, it's interesting. That's why we sort of ended up putting it over here in the interview, because it's a more complicated question than just, you know, tagging an organization with that fact. It's almost like you have to talk to them. to know the answer, really. Yeah.
And we also were going to ask them this question about, are there gaps in the area of services in the areas? So get a little more qualitative information about what those gaps are.
Mm-hmm.
So just to be clear, this question gets at what, if we ask them and clarify, this question gets at that pretty well.
And then, yeah,
Okay.
I'm seeing nodding heads. I'm trying to look.
Yeah, I mean, I guess it says check that all that apply. I suppose we could have another one if there's something, you know, if they need to explain any kind of place for like a narrative, I imagine.
Well, and remember, this is an interview.
Oh,
So
okay,
we're
yeah.
going to be talking to them about
Right.
all of this.
Yeah.
But what's
That's
your
true.
follow-on question you were thinking of?
Well, it says check all that apply, and I'm just wondering, you know, like for example, if it's like they do a lot of telehealth, you know, or something, I don't know.
Right.
That might be something they indicate as well.
Yeah.
Okay. And then does someone have a standard list of like the cities and regions, the description here? I left them open-ended because I have, I know that these are in those regions, but is there a way that you typically list out the regions?
Felice, how did we categorize it when we're doing data?
I just go by zip codes and look on the map, but it's just based. There's no, I also look at our border supervisors, how they're assigned to different districts, but there's no list.
Mm-hmm.
But I can help support that. Or if
Maybe
there's a
Felice,
list.
you and I can touch base and I can get it. Does that
Yeah.
make sense?
Yeah.
Okay. Great.
That's great. Thank you, Felice.
And then I don't want to go over this because for the purposes of time, I don't want to go over every question, but the other area that I wanted to talk about, we're going to have them talk about the different programs and answer some questions about the different programs. We're going to ask them about the social determinants of health and about evidence-based practice, and get some questions related to their capacity and how to build capacity in evidence-based practice for evidence-based practices. And then getting at language, we thought we would ask them the percentage of clients, sort of the demographics of their clients, and whether they serve clients that are non-English speaking, and then what percentage of them are non-English speaking. So we get a sense of a little more nuanced, it's going to be estimates, but a little more nuance about how many folks they're serving that don't speak English as their first language. And then a sense of what languages they do speak. And then some qualitative questions here that you can see about having them kind of describe their ability and any gaps there are in terms of language ability, and the waiting lists. Because what we hear from people typically and all over is that the waiting lists are different for different languages, and that Spanish speaking folks can also often wait for services, and other languages can wait for services as well. So just wanted to get the affirmation that this information will be valuable once we aggregate it from those agencies from you.
Robin, did you have a question?
Yeah, Barrett, could you scroll back up to, I'm curious, I've just kind of been zeroing in on the evidence-based practice.
Sure.
Because I've been doing a little research on evidence-based practices that.
I think you just passed it.
Okay. Yeah.
There it is. Yeah.
Okay. So, okay.
So what I did is asked if they provide any evidence-based interventions, and if yes, these are the ones that are in the state plan.
Mm-hmm.
But I wanted to also give them the option to provide other ones, because that plan is likely to expand, right? More information and evidence, more interventions are going to be added to that clearinghouse.
We hope.
Yes, and then I asked them this question, their level of interest is as an agency in providing evidence-based interventions, because some agencies are not interested in and don't have the capacity and are not interested in it, in the future. And that's important information to know. And what they're interested in, what the barriers or challenges are for them, because there are numerous challenges. It can be a high bar for agencies to start delivering a new evidence-based intervention. And then this question about what would it take, it gets at sort of what could be done to make it easier for you to deliver evidence-based interventions.
Thank you.
And I'm open to other ideas for how to gather that information.
Well, I could probably already answer the question of what it's going to take. It's going to take a lot of money.
And training. Yeah.
I mean, that's definitely true. I wonder if there's a way, Barry, to have some kind of secondary question to that. If there was startup money available, would an agency be able to find the capacity more easily?
Oh.
Because I think that, there's obviously multiple things that cost in starting up a evidence-based intervention. One is, purchasing any training or materials to do a evidence-based practice to fidelity, but then there's ongoing costs.
Right, because there's no train the trainer model for a lot of these.
Except for Triple P, which should be in the clearinghouse.
I know. I've been doing some interviewing on the two that are there for parenting, the healthy families and the parents as teachers. And there's definite limitations because they only do 0 to 5. And they have a very small window of when you can bring the families in. And one of them, and I can't remember which one it was, doesn't even allow a waiting list.
Healthy Families America doesn't allow waiting lists. This is Lael.
That's interesting.
Did you say they don't allow them, Lael?
No, because it's such a small time frame to engage the families that it doesn't do any good to leave them on a waiting list because they outgrow it.
Right.
Katie,
I would say that depending on who you're talking to at these different organizations, until the last 3 years, I don't know if I could have told you what it would take to implement a evidence-based program. It really does take the model, the data collection system, the curriculum, and the staff. And so all of that is money and it takes time. It's taken us 3 years to learn the Healthy Families America model and to implement it so that we could collect the data to even start the system. So I guess I just want to caution that if you'd asked me 5 years ago, I would have said, yeah, I definitely support it. And, time and money is what I need. But it's not that easy.
Yeah.
I want to echo what Lael is saying, because we did use an EBP for years and it was extremely expensive. And ultimately we did have to dismantle it because it was just so expensive, so it is kind of an odd question. I think maybe the desire, it may be more about, if it's something that someone is wanting or a provider is saying, yes, we've always wanted to implement this, but because of financial constraints and then just time, to have someone dedicated to managing the EBP and, the dashboards, there's just, there's a lot of implementation as Lael is bringing up. And so I just wonder how, that question is,
Katie, did you have a question?
Yeah, a couple on this EVPs, I think, because it makes, all of our collective hearts race. But I think just a general, and maybe this is sort of in that first one, but I just a general inventory about what EVPs are people doing now? That might be in that sort of current one, but it's a little bit more than just but I would do more more than just that list, because some people are doing, San Francisco, we do a lot of triple P and
Right.
incredible years. And I think if we start building, and I guess you have that other, but if we start building that, then maybe that's a way of pushing increased EBPs that are there. I also think there's an opportunity to ask about funding, and I sort of dovetail off of what Robin said about how do we engage in the community pathway separate and apart from EBPs? Is there opportunities, for example, for FRCs to actually provide that front end work and those referrals? And then if we really are talking about money and resources, like how do you actually get money and resources to engage in prevention planning? Like these kinds of conversations. How do you get more people at the table? And I think it's sort of what was raised earlier in terms of stipends and dinners and that kind of thing, to be able to really come to the table fully.
Mhm. And so maybe we could add those specific ones to the list, to the 10, like triple P and what was it, incredible years, and maybe even, I think Sarah mentioned motivational interviewing. I mean, I know that's kind of a generic one, but that one's, I think, in
It's
there.
already there, the motivational.
That's on the list.
Got it. But I wanted to mention too, in the chat that Jagdish joined us. Welcome, Jagdish, and had a great suggestion that several people agreed with around maybe framing the follow-on question to ask what supports would be needed to maintain an EBP.
Yeah.
To make it a little
I
less
think maybe
about
we can-
startup and more
We
of a,
can, yeah, make it, we can modify this question. But I'll put some notes here.
Mhm.
And I was gonna say with the EBPs, I do understand that those look like they're the 10 from the state plan. But yeah, I would recommend having the ones that aren't all those ones, like, because you need to know what's there. So in the future, if the state plans on adding more, at least we have, or you will have that information too, about what is currently being used and what's more effective in your community.
Mhm.
So I had triple P and safe care. I think people mentioned another one that.
The incredible years.
Okay.
And is PICT on there already? Yeah, PCIT, I mean, yeah. Okay.
That's on the list.
And I may have missed it, but are you asking if they're providing it in a different language for some of these?
Well, we are asking at the top all the different programs that they have and what language they provide it in.
Okay, thank you.
So yeah.
Okay, so does that feel like a little bit more comprehensive list for Marin, you guys? Are there any other big ticket ones that are out there that we should just overtly list here?
Well, I just want to say one of the things that's really coming up, I've been kind of really immersed in doing some of this research on these. But some of them, I mean, I don't know how we can think about the intersection of some of them in terms of the cultural aspects. Because I know the tribes have their own totally different parenting stuff that they're doing. And I don't know, I just wonder if there's a question there somewhere.
What I may be hearing is what kind of culturally relevant or inclusive services are you providing for those vulnerable populations? Is that what I'm hearing, or?
Yeah, I think so. Yeah, because I know not all of the strategies or evidence-based practices are necessarily
right.
Culturally relevant. Yeah.
Yeah, or even accepted in certain communities, right? I don't even know. There's different nuances, right? So
or for that matter, researched in different communities.
Yeah.
So, I mean, we could ask, are there other specific services you provide, you know, specifically culturally relevant services that you provide that you want us to know about?
Yeah.
And then I would list like some vulnerable populations like LGBTQI tribes.
Right.
That would be good, you know, to have in.
As a prompt. Yeah.
Okay.
And
out in a Survey Monkey, is that the plan or?
no, this is an interview template, actually.
Sorry, I heard that and I'm just.
Yeah, that's okay. We got so many question sets swirling around. It's hard to keep track. Yeah, these are so nuanced, you know, that I think it'll really lend itself to more of a conversation with folks. Yeah. And then I think I just saw one other, family connections, as one more in the checkbox list there, Barry, to add.
Is it
Family connections? Okay.
Is that a evidence-based practice?
You know, I think
that's a program, family connection.
That's what I think. Yeah.
Yeah.
Okay.
Depending on who we're talking about.
Okay.
Yeah, family connections was BACR's I believe the MDFT program. So, but it's not that family connections is a program, not an evidence.
It's not even a promising or anything like that.
No,
Yeah. Okay.
it's
okay.
a program.
Yeah, got it. And so
unless there's a new EVP called Family Connections, I could be wrong. I just know that was a program name. So
yeah. Okay.
And it's in HHS. I don't know if behavioral health has one as well, but interesting. Definitely not evidence-based.
Okay. Okay. Leave that off. All right. What else, Barry, on your
that was
template
the
here?
things that I had identified that I wanted specific feedback on. Police and Katie, you both have your hands up. And I don't know if you.
Thanks. Barry, can you scroll up to is there a list of agencies or programs that you'll be interviewing? I think I missed that.
Yeah, it's actually here.
Oh, it's that list.
Yeah.
Can you remind me again how there's Center for Domestic Peace. Okay, and the reason why I'm asking is because I hate to belabor this point about the geography piece, and just in Marin, I think sometimes geography is a proxy for ethnicity. And I really think we'll get a lot of useful information in terms of gaps in services. So, and Gina and Bree already alluded to this in terms of a follow-up question. A lot of service providers might say that they provide services countywide. And so there was mention about virtual services, but some services you kind of need to have in person. I'm thinking specifically about Center for Domestic Peace. They may need to provide in-person support to clients who are escaping a dangerous situation. So they might have to drive folks to shelters. And I just want to make sure that there's a follow-up question that sort of nuance doesn't get lost. And in particular, I'm thinking about Center for Domestic Peace because I know that that's sometimes a gap for example, in West Marin, that sometimes that's a very big barrier for residents not reaching out to Center for Domestic Peace because they know that they may not get that sort of in-person support sometimes. So if there's a way to, when you're conducting interviews, to kind of get at certain things like that.
Yeah, this is what we hope to get at it with, but I'm open to other ways to get at that. I mean, this is the agency themselves reporting that there's a gap.
You know, it makes me think, Felice, that maybe we should be asking a question of these agencies. What are your clients telling you, or what are your community members telling you about, because they must have done some of their own evaluative work around gaps as well, possibly, of folks that they'd like to engage but can't for whatever reason, or it hasn't been successful. I wonder if we ask it from them speaking from their clientele or something, because we're going to get some of that from the needs assessment, but we're not, you know what I mean? We're not sure how deep it might go for that specific kind of a piece of input.
And it sounds like there's two pieces. It's who are you able to engage in the areas you're around? And if you're not able to engage more folks, why not? So it sounds like you're talking about zip codes, right? So why aren't certain populations being served? Because it sounds like some agencies are saying can't countywide, but they can't possibly do countywide. Maybe.
There's some challenges with transportation. The county is hard to sort of navigate. There's certain areas where there's less providers because of numbers, but that doesn't mean that there's no need. So I'm just wondering how we get at that those sort of nuances. And then the point I made about geography is sometimes a proxy for ethnicity in Marin. Like, I'm just wondering how you're going to get at that. So, yeah.
I'm hearing a needs assessment. So you're asking questions about needs and how are you meeting population needs in certain zip codes? And if you're not able to meet them, what are the challenges and barriers that you're up against?
Yeah. And I see Barry highlighting that question. That's probably sufficient.
I would still ask about needs. Like, how do you feel, you might better meet the needs of a wider population? Or because I've heard this topic come up several times in this meeting, and how it's really talking about meeting the needs of the community. So I think it's important to somehow address that piece that police brought up. Like, what are the gaps to meeting the needs of a wider range of clients? Like,
Yeah, I tend to agree with that, because I think that's the gap we're trying to ask about. It's not so much a gap in pure services available. It's a gap in need against service that they can offer. Right. And from their perspective, how do they view that? I think that would be really, because I think it asked that way, people would be honest about that. Right. In terms of everybody, of course, wants to think they can fully meet the need, but that may not be realistic. Okay.
Well, let me play around with it.
Like, how might you characterize the need in those communities that you checked about, in those areas that you deliver in above, and how well do you feel your services are meeting that need? Yeah, that's great. Okay.
Leslie, can I jump
Yeah.
in that? So if you ask me this question, I would say for home visiting, we provide services for all of Marin. If we talked about West Marin, I would say we offer services 1 day a week or up to 4 people right now until we can get more. If you ask me about Marin City, I would say we offer services, but they're not often accepted. And that is because of, probably because of who we are, Health and Human Services, government, and because of what our home visitors, the culture of them, they're not aligned. And so we haven't been able to support that community as well as we would like, knowing that we're not as accepted as well.
Yeah.
And so it's not just what we offer, it's
how we're received, how we're perceived. Yeah.
And then sensitivity to that.
That's great. I love that. Yeah. And knowing that that's what we want to know, I think in an interview format that there'll be great opportunity for like follow on. You know what I mean? As people start talking about this. Does that make sense, Barry, for you?
Yeah, it makes sense. I got these down. These probably won't be the end questions, but I think we got the gist of it.
Right. All right. Okay.
So I guess our next steps is to finalize this and then do some outreach to folks for the interviews.
Yes. Exactly. And that's you and I at this point, Barry, unless we have some volunteers from our group
We would
here
love more volunteers to do that, to
that
help
would
us
like to
the
do one
interviews.
or two interviews or something, or we would welcome that, either of your peers or, you know, of if your organization is on this list, maybe. Maybe. Oh, there's Katie. Happy to do interviews. Excellent.
Hurrah.
Wonderful.
Oh,
And Robin is also available. Yay. Thank you so much, guys. That's wonderful.
Marin is on the list. If you guys want to send me the questionnaire, I can just complete the form.
I thank you for that, Isara. I think our plan, and Barry, you can speak to this too, would be to make sure that all of our interviewees, whoever we do interview, does have the form in advance so that they know generally what we're going to be asking about, and they're not blinded by this. But I would want to give you the respect, Isara, for a real interview, right? Like, we would be happy to interview you. I don't want to make you fill it out because it kind of changes the nature of the, you know what I mean? Like, we want to pull the information as easily as possible from your conversation around it. Does that make sense? Yeah. Okay. So the next thing is we'll time this, we'll figure out how, you know, about how long it might take and get contacts. We may look to you guys, all of you as well, to find out points of contact for these organizations as well. Okay. So we'll just do some follow-up via email around that, Barry?
Yep, we'll just reach out and get contacts, and we'll finalize the interview guide.
Okay.
As next steps.
Okay. Sounds good. Well, appreciate your efforts on that, Barry. Thank you so much for sharing all of that. I think it's moving forward. I think if we can get all that input from, you know, 16 or 18 organizations, we'll really have a rich array of deeper dive data to supplement the matrix.
Agreed.
So, yeah.
Thanks for all your feedback and help.
Yeah, great. Great, everyone. Thank you. Okay, we took a little bit more time than planned. So but I think it was well worth it because it was just important to get that right and be asking the right kinds of questions. So we were going to take a break. I apologize. If we take a stretch break now, we should pretty much just go home and wrap things up. So the last thing that we had wanted to do, and we can certainly roll this over to another format or another meeting. I think we don't really have the time to look into it deeply today, but perhaps we can put these questions in our minutes, Anne, because what we want, let me just show you what the questions are, and you guys can be thinking about these, and we'll maybe loop back around to this dialogue when we meet next month. But, you know, we wanted to just sort of step back and talk about community capacity a little bit more broadly for Marin County in terms of, you know, thinking about this comprehensively and sort of what we're thinking of as the family serving system, if you will, which is really, right, a collection of public and private and voluntary organizations and entities that you want to have come together to strengthen you know, the resources and the response to families in need in Marin County. And it's really kind of the community safety net, if you will. And it's what we're both trying to identify through this process and begin to improve with the prevention planning efforts. And so, you know, we wanted to just explore and get your thoughts about community capacity in Marin, because every county is very different. And so we just had kind of a series of 5 questions that we were hoping that we could dialogue with, which we can do next time. But just to orient you to what the questions are, you know, one is sort of how would you characterize the level of commitment of Marin's family serving system to work together and kind of jointly invest in a comprehensive child abuse prevention plan, right? I mean, clearly, you know, child welfare services and its partners are taking the lead on this, but ultimately, it would be fantastic to have this plan kind of owned by a broader, you know, coalition, if you will, within the community. So as you kind of think about who those partners are and, you know, kind of how you would characterize your readiness for that at this moment, and you know, what kinds of cultivation might need to be thought about over the next coming months and years to make sure that that kind of a network and system is starting to take some root for Marin. And we may learn, right, from the asset map that some of that exists already right now. We're going to ask about partnerships and different things as we collect that information. But just wanted your take on that too. And also this question about, you know, how collectively committed is Marin's family serving system to reduce or eliminate disparities in well-being outcomes for children, youth, and families of color and tribes and other marginalized populations. You know, is there a strong community commitment to, you know, interrupting the kinds of disparities that we've seen in the data, and how do we sort of, you know, capture that momentum or build that momentum as this goes forward. And then this kind of speaks to what some of you were talking about the, you know, some of the evidence-based practices and what it takes to put those in place, but just thinking about how adequate are the staffing levels of Marin's family serving systems to effectively implement new prevention programs and practices. I think we'll get some of that from this interview process with the organizations that we're talking with about their staffing levels and whether they're challenged with that right now or not. And then these last 2 questions are more about other kinds of infrastructure elements that would help you both establish and sort of continue to promote collaboration around prevention work in terms of the capacity for the kind of data management requirements that would be needed to sort of operate and evaluate any kind of new prevention programs or practices. And then there's our evidence-based practice question at the bottom. So just wanted to get your sense of that. Any initial thoughts about any of those? We don't have to go into great detail, but any comments you guys have about how Marin may be committed to these things already, or work that's maybe already underway that reinforces any of this, or are we kind of going to have to build this from the ground up?
Do you think a lot of this will start kind of bubbling up from the interviews and surveys?
I hope so. Yeah. Yeah. I would definitely like to use some of this as kind of a guide, right? To see how much of this we can respond to. Because I think it'll help us determine, you know, where there's strengths to build on and where there's capacity building to do, and relationship building and partnership building. So we'll put these in the minutes and you guys can continue to kind of think about this, you know, from your own perspective of just your knowledge of the community. And then as we start to interpret some of our findings from the needs assessment and the asset map, we can use these as a guide. Thoughts, Troy or anybody?
I just think it's a really good way for us to talk about the capacity and not necessarily, you know, use the capacity assessment. Many people are doing things in different ways. I think this is a great way to kind of put it out there, and then we may want to translate it into the capacity assessment.
Oh, definitely.
That has been provided to us to kind of look at it, use it as a conversation tool. And I have certain folks that are using the capacity assessment as a guide as well, you know?
Yeah. 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 Good. All right. Well, with that, we'll meet again next month, you guys, and hopefully we'll be starting to look at some preliminary findings from our needs assessment. You know, hopefully, maybe we've been able to reach out and conduct some interviews and starting to look at our organizations and resources within the asset matrix and begin to think about, you know, what story does this tell? So that may be a rolling question here as we continue to keep some of our inquiry processes open for another few weeks. So we'll just continue to, you know, start to build themes and continue to add to them as we get more input, because ultimately we want to get to a point where we can really kind of wrap our arms around, you know, what have we learned about our community so far, so that we can really start to develop some ideas about strategies and what seems to bubble up as some priorities here to really begin to address in our comprehensive plan. So with that, mark your calendar, right? September 21st will be our next meeting, and we'll look forward to seeing you all then. Final comments or questions or? All right. Thank you guys so much, everyone, for all of your input and hard work offline. I know we'll be reaching out to everyone and answering any of your support questions as we continue our conversations with the community. Thanks, everybody. Have a great afternoon.